Welcome guys, Mr. Hyatt here. This is the chapter 15 APES lecture. You see the title there, it's Environmental Hazards and Human Health. We're starting this chapter with a case study on mercury's toxic effects. And the whole key to this chapter is going to be how well do we evaluate risk as a population, and more specifically, how well do we evaluate risk as individuals. Often, we're not aware of the risk that we face. People up the food chain, for lack of a better term, make those decisions for us. The EPA makes a lot of those decisions for us. Our elected officials make a lot of those decisions for us. So you see mercury, which we've talked a little bit about before through biomagnification, can be dangerous. At low levels, we have some natural levels of mercury. They're released from volcanoes and things like that. I told you guys the story of one of my college roommates that had mercury poisoning from eating too much canned tuna. So obviously, when it adds up and it bioaccumulates up the food web, it can cause problems. We use mercury to separate gold from ore, so that can cause, if we use a ton of it and it gets amplified up the food web, that can cause some problems with us, uh, even here in central Indiana. So that bottom question is kind of the driver and kind of the take-home message of this whole chapter. What everyday health hazards can you avoid, and what can you do to limit your exposure to them? And then what risks are you facing that maybe you're not aware of? So first thing we have to look at is the different types of health hazards. So we make lifestyle choices that have biological components, chemical components, physical components, and cultural factors. Truthfully, the physical components are going to be the one that we spend the least amount of time on. We will touch on it later, but that's basically like a branch falling on you or something along those lines. It's a risk, but we're pretty good at avoiding physical risks. So a couple of definitions here. So I've used this term risk several times. That's a specific number, but it's also a vague term. So I know that's a little confusing, but when I say risk as an environmental scientist, I mean the probability of your health being harmed by a hazard. Hazard is anything that can cause injury, disease, or death. Um, so it could also cause economic loss or damage. You see there, I think that makes sense. Risk assessment is the use of statistics to estimate the harm from a hazard. So how risky is something? How dangerous is something? And then risk management is basically how do you reduce those risks and how do you limit the risks to yourself? So in terms of risk assessment and risk management, they're going to play off of one another for sure. It's tough to manage a risk if you don't know what it is. It's also tough to manage a risk if you don't know how likely the event is. Here in central Indiana, we don't have to worry a lot about earthquakes. A little bit, but not a lot. We definitely don't have to worry about hurricanes. So we don't spend a lot of effort and financial commitment on something that's not very likely. So this is definitely a very topical thing right now. Think about the things that are going on in politics and some of the scare tactics that are used in, both political parties use scare tactics. And so part of the problem is that as a population and as individuals, we do a terrible job of assessing risk. Some things we have irrational fears of. I'll give you kind of a silly example. My wife had a nightmare several years ago about orcas. It was something like the world flooded and she was stuck on this raft or something, and orcas were just wiping out whatever people were left, which, is very impractical. Orcas don't attack people in the wild, and their throat is about the size of a grapefruit. So today, my wife is terrified of orcas. Anytime she sees an orca on TV, she changes the channel, and she's afraid of orcas. That's an irrational fear. The likelihood that she's going to be eaten or attacked by an orca is very, very, very low. But it's a fear that she has. And like I said, that's a silly example, but there are many less silly examples of that we deal with every day in our lives. Consider this when you watch the news. Consider this when you watch political ads. How likely is this event? That should be part of the risk assessment. And then how do we manage it? I read a story not long ago about a law in the Indiana State House about outlawing eyeball tattoos. Well, that's not a very likely event, and yet we were spending money as a state debating whether we should have a law on it. So the risk assessment and the risk management don't quite match there. So let's spend some time looking at the types of hazards. Biological hazards, we know bio means life, so those are going to be anything that's alive. And viruses get rolled in here sometimes. I would I would roll viruses in here, even though I do not consider viruses alive. They miss some of those requirements that it takes to be considered alive. We talked about way early on in the semester. Chemical hazards are often going to be things like pollution. Not necessarily all man-made pollution. Some of it could be natural pollution, but that's mostly what chemicals are going to be. Natural hazards are going to be, oh, I'm sorry, we'll also talk about BPA as a chemical hazard, so chemicals that we use in our food and kind of the opposite of the organic agriculture movement, pesticides and things along those lines. Natural hazards are going to be things like fire and earthquakes, natural disasters, all those types of things. Cultural hazards will be things like poor working conditions, poverty. Often lifestyle choices get rolled into cultural hazards because things like smoking are cultural. Poor food choices, overnutrition, malnutrition, things along those lines, casual unprotected sex, all those types of things would be cultural hazards. And even that one, you can tell there are going to be some biological hazards there as well. So there's definitely some overlap here, and it's tough to pinpoint sometimes as which type of hazard this is, but those are our, four-ish, five-ish different types of hazards. 15.2 is all about biological hazards, so uh, really a lot of vocab more than anything else. You're probably familiar with these, so this section hopefully is pretty easy for you. But an infectious disease is going to be something that can be passed from one person to another. I'm sorry, an infectious disease is going to invade the body. Transmissible is going to be passed from one person to another. I was reading and talking at the same time, so sorry about that. A non-transmissible disease does not spread from person to person. So there are some examples of those things that are not contagious that we pick up from viruses and things like that that we can't pass straight from one person to another. A couple of words that are misunderstood, misused in society. An epidemic is going to be an outbreak of an infectious disease, but that's just going to be in one country. Pandemic is when it affects the whole globe. So something like Zika started out as an epidemic and then kind of spread to multiple countries, so it became a pandemic. Sorry, I thought I skipped a slide there. So viral diseases kill large numbers of people. Like I said, viruses aren't quite alive, which is why they're not affected by antibiotics. Antibiotics only kill living things. Some viruses can be transmitted by airborne particles. There was a big fear I can remember when I was maybe in late elementary, maybe middle school. Ebola was kind of the Zika of that era. And there was a fear that Ebola was going to jump and be spread through air. And that would be really, really scary because then there's no way to protect yourself other than, you see in Asia a lot people wear those masks to protect themselves. That's the goal there is to protect yourself from airborne illnesses. Some examples of viruses that you've all heard of, HIV and Hep B. Those are both transmitted by unsafe sex and sharing needles. And then avian flu is transmitted to humans from animals. Swine flu is another that you heard a few years ago. Those are all viruses that caused illnesses in people. If you look here on this graph, there are things that are in red count as biological hazards. So there's a lot of red here. The big things aren't red. Pneumonia and flu is pretty big. TB is still pretty big somehow. HIV/AIDS is still pretty big. And then these are also quite large as well. So if you added all those up, that's a significant amount of people that die every year from biological hazards. Many people have latent TB, which means Latent HIV is when you carry it around for years and you don't present symptoms. Latent TB is the same kind of thing, and it certainly has a shorter latency period than HIV does. But a lot of people carry around TB without realizing it, and then all of a sudden they get really sick really quickly. That's really common in developing countries, much more so than here in the developed world, because typically we can catch it earlier. Flu kills the most people worldwide. That's why it's really important you get a flu shot every year. And then HIV and AIDS, there are treatments, but they're really expensive. Most people, you probably are aware of this, most people that die from HIV and AIDS don't die from HIV and AIDS. They have HIV and AIDS when they die from something else, typically pneumonia. That's a really common one. So that's what that secondary infection point is about. Really prevalent in sub-Saharan Africa. We looked at age structure diagrams on Friday. Check out Botswana's age structure diagram. Look at how many young people there are with AIDS. Look at the small population that doesn't have AIDS. That's troubling. We'll continue to see this kind of phenomenon as time progresses. These folks aren't going to live, they're not going to make it up here. So this bubble is not going to matriculate up like we see in the US with the baby boomer generation, with that bubble just kind of working its way up every couple of years. These people are sick, they're not going to make it to be 85 years old or maybe 65 years old. Some of them will, but not many. It's going to continue to have this pattern. The promising thing is this. We have had some success in limiting the spread of HIV. Still really expensive to cure, but we're getting better at limiting its range. We're getting better at limiting exposure. So the hope would be that by the time these people get up here, the bottom of their age structure diagram looks more like this, where there are far fewer people born with HIV and AIDS than with and without. I think you understand what I mean. I got lost in the middle of that. Malaria is another common one, carried by parasites, caused by parasites carried by mosquitoes. Has been on the rise since 1970. There's an insecticide-resistant plasmodium that makes it difficult to treat malaria. Think about what we've talked about with DDT and some of those chemical hazards. And that's something that we'll be talking about again here in the coming days. But again, that's prevalent in sub-Saharan Africa where there are lots of mosquitoes. And if you look at this map, where we see malaria is where we see a lot of mosquitoes. So how can we reduce infectious diseases? Well, we're having some success with immunizations, vaccines. Vaccines are really important because they prevent some of these infectious diseases. There are things like oral rehydration therapy that is basically like it's like a gel basically that folks can drink, and that reduces the deaths from dehydration, particularly from diarrhea-based diseases, which kill. I can't remember what the number was, but that was one of those red bars on that graph a few slides ago. So this oral rehydration therapy basically lets patients rehydrate themselves without overhydrating themselves. Sometimes that's an issue. They have diarrhea, so they're super dehydrated, and they drink a whole bunch of water, and their body can't take it in, and they end up just expelling it again. The gel helps with the absorption rate, so it helps rehydrate folks and keeps them from dying when they do get one of these infectious diseases. Much more medical research is needed in these developing countries. We're coming up with better field measures. So like this oral rehydration therapy, we're coming up with better things to use in the field versus having to come to the hospital for it. In a developing country, you don't always have access to a hospital or a doctor's office or something like that. So we need to come up with ways to treat folks in a non-sterile environment. I'll pick up with 15.3 in video 2.